with a dermoid cyst. Well, the problem with dermoid cysts is that dermoid cysts are often so dermoid cysts can be in all parts of the body, so you can get them over in all sorts of funny places. So we're talking about one sort of underneath the skin here, obviously. They're a bit of a worry if we are concerned about a dermoid cyst. The classic is here, external angular dermoid here, also midline in the skull, and they are due to a failure of fusion of the skull. As the skull forms as a baby, it forms in different bones, which then fuse together. And if there is a failure of the bones to fuse together, you can get a little outpoking and a little cyst forming, and these are classic areas for it, and that's called an external angular dermoid here. So if we are concerned that it is a dermoid cyst, we would request a scan using an MRI to look for any intracranial extension of the cyst. We don't want the cyst to still have a communication. So sometimes there remains a little defect in the bone and a communication into the cranium, so that if you just sort of cut the cyst, then CSF, cerebrospinal fluid, will leak, and that is not something you want in the minor ops room. It's something. So that is something that will be done in combination with a neurosurgeon, and you want to be forewarned about that. So you'd want to scan. So we're always a little bit anxious about what's here and here, especially if they've been